Hi, I'm Krisga, National Patient Pathways Manager for St John, and in this short presentation we're going to be discussing the Clinical Hub rollout in the MidCentral DHB area in the third quarter of 2017. The Clinical Hub is a clinical telephone assessment service or secondary triage service for low acuity 111 callers. It's a partnership initiative with Home Care Medical, and it was originally piloted in mid-2014 in the Auckland metro area. Soon after, in 2015, the Clinical Hub was expanded to the Northland, Waikato and Greater Wellington DHB areas, and due to the success of the Clinical Hub, the Ministry of Health is funding a full national rollout during 2017. So by the end of 2017, all DHB areas across New Zealand will be live, which is great. So the objectives of the Clinical Hub are very much to provide the right care at the right time to low acuity 111 callers through specialist clinical telephone assessments and referrals to community health services such as GPs, urgent care and other health pathways. We don't think that the right care is sending an ambulance to all low acuity patients, and for most of those patients to be transported to the emergency department where they may not get the best care appropriate to their condition, and they may have to wait an extended period of time. So the Clinical Hub is about bringing care closer to home and in the community where it's safe and appropriate. Secondly, the objective of the Clinical Hub is to reduce the volume of ambulance presentations at EDs where it's safe and appropriate to do so, and connected to that, also to improve ambulance service capacity to respond to time-critical calls in the community, such as STEMI, stroke, and major trauma, so we can really free up resources to improve outcomes for that group of patients. So how does the Clinical Hub work? Well, it all starts with a 111 call from a member of the public, and all 111 calls go to one of 3 ambulance communication centres across New Zealand in either Auckland, Wellington or Christchurch. When the call is answered, it's answered by a call handler who's trained in answering, processing and ensuring calls are triaged in the appropriate way initially. And call handlers use a system called ProQA, which is a recognised international system that ambulance services utilise. ProQA will determine a response colour, one of 5, so purple and red is immediately or potentially life-threatening, orange, which is urgent or potentially serious, or green and grey, which is neither serious, life-threatening, and is non-urgent, just like the old Priority 3 if you are familiar with that system. The key point is that if somebody rings up with a problem that's classified as purple, red or orange, nothing changes. So patients with potentially or immediately life-threatening conditions or who have an urgent problem, they are sent an ambulance, the closest and most appropriate ambulance, as soon as possible. So for urgent or time-critical patients, nothing changes. But it's really these green and grey calls which we're most interested in when it comes to the Clinical Hub. So certain types of green and grey calls, so certain types of low acuity calls, will go through to the Clinical Hub. And in the Clinical Hub, which is within the communication centre, either a nurse or paramedic will look at the job and phone the patient back to gain some more information about their condition and use a decision support tool such as Odyssey or the Manchester Triage system to conduct a more in-depth assessment to determine best care. Following triage, often an ambulance response is still appropriate. In fact, in 70% of cases following Clinical Hub triage, an ambulance is still sent. However, for a core group of low acuity cases, referral into urgent care, general practice, or simply advice for self-care and a self-care plan for the patient is more than appropriate. So following triage, either an ambulance will be sent or the nurse or paramedic will work with the patient to refer them to urgent care, general practice, other health pathways, or give them advice for self-care. So this is a graph showing the system impact of the Clinical Hub within Auckland during the pilot year. So as you can see, prior to the Clinical Hub being implemented in July 2014, the actual number of admissions or transports to Auckland EDs was well above what was forecasted, and following implementation of the clinical hub, the actual number, the yellow line here, was well below what was forecasted, which of course is the green line, in terms of arrivals to ED or EDs within the Auckland metro area. In 2016, when the clinical hub was expanded to the Northland, Waikato and Greater Wellington area, there were approximately 200,000 incidents within those areas, or in other words, 111 calls. 26,000 of them went through the clinical hub, which was about 13% of incidents, and the reassuring thing is that an ambulance was still dispatched to 73% of cases, where following additional triage, an ambulance response was deemed appropriate. However, there was a core group of 27% of the 26,000, these ones down here, where referral to a GP, urgent care, other health pathway, or advice for self-care was deemed to be appropriate. So here's a clinical case study, and this of course depends on what's available within your area, but over time we can incorporate pathways into the clinical hub directory of services. And this gentleman, prior to the implementation of the clinical hub, phoned 111 3 times for the same complaint, which was basically a history of urinary discomfort, and 3 times he underwent a unscheduled ED visit. But following the clinical hub and nurse-led triage, the patient was assessed over the phone, a registered nurse was contacted, a district nurse attended the patient, replaced the IDC, was able to provide some much needed face-to-face education, and this really avoided further unscheduled or unplanned ED attendances, freed up the ED, but most importantly was best for the patient because he was treated very competently within his home. So the national rollout plan for the clinical hub is as follows, and as you can see the current areas here are already live, so that's mainly the Auckland area, Waikato, Northland and Greater Wellington. In quarters 1 and 2, so in March and then again in late June, the clinical hub was rolled out in these DHB areas here. And then in quarter 3, we're implementing the clinical hub in the Taranaki, MidCentral and Wanganui areas, followed by the remaining DHB areas in the 4th quarter. So how will this impact services or the population within the MidCentral area? Well, there are approximately 24,500 111 calls per annum in the MidCentral DHB area. And of that 24,000, about 16% of calls are likely to go through the clinical hub for expert assessment. And so 16% of calls equates to about 4,100 patients. As I explained before, of that 4,168, or that 16% of all calls, an emergency ambulance is still dispatched to about 73% of cases because following additional triage, that is what is deemed to have been still most appropriate. However, there's a core group of 27% of that 4168 who go through the clinical hub where referral to a GP or into urgent care is appropriate, and that'll be about 770 patients a year, or where simple health advice and advice for the patient to call back if there's further changes will be appropriate, and that will affect about 354 patients a year. So in a nutshell, there's 24,000 incidents within the MidCentral area each year. About 16% or just over 4,000 will go through the clinical hub for additional assessment. Most will still get an ambulance, but there's a core group of low acuity patients that will either get health advice or referral to a general practitioner or into urgent care. And it's also worth noting that even if we dispatch an ambulance, just like at the moment, there are a number of patients that will be treated on scene by ambulance personnel or transported to non-ED medical facilities such as POAC. And that's all for the presentation today. I'd like to thank you for your time, and if you have any questions, you're more than welcome to contact me at the below email address.